This message is for doctors and doctors only. If you're not a doctor, just keep scrolling. Doctors, you gotta stop treating symptoms with drugs. You just have to stop. It has to end. I mean, when does it end? If a patient comes to you with a symptom, don't just give them a drug because the drug matches their symptom. Why don't you do some testing? Why don't you do some imaging? Send them for an x-ray, send them for an MRI, an ultrasound, a CT. I mean, do something to help them fix or find and fix the underlying root cause of their problem. Don't just give them drugs. By giving them drugs, you're not actually helping them fix the root cause. In fact, you're hurting them even more because you're just giving them drugs to mask the symptom. Meanwhile, the true root cause of the problem doesn't get fixed and it keeps getting worse and worse and worse. And while they're on drugs, the root cause of the problem isn't getting fixed. Now they're having other problems. You know, it's like putting a duct tape over your check engine lights. That's not solving any problems either. Just putting duct tape over your check engine light is going to mask the symptom so you won't see it. But now that check engine, now whatever the root cause of the problem is now causing other problems. And so here's a radical concept. And I know it may be a little bit of a stretch for you if you're a medical doctor, if you're an MD or a DO or a nurse practitioner, and your sole focus is on treating symptoms with drugs and surgeries. Here's a concept. If you can't help your patient by fixing the root cause of their problem, refer them to somebody who can. Find out where they can go. If the patient has to pay for themselves, the imaging, the testing, then have them do it. It's okay if insurance doesn't cover 100%. It's okay if the patient has shitty insurance. It's not your fault that they have shitty insurance. That's their fault. That's the insurance company's fault. We are enabling insurance companies by only doing what their insurance pays for. You're not helping the patient. You're helping the insurance company. And maybe you're helping your pocket. But stop enabling the patients and the insurance companies. Help your patients find the root cause of the problem. Don't just treat the symptoms. Help them find the cause. Thanks.